Elena, and this past summer I did spinal cord research and rehabilitation in Louisville, Kentucky for Dr. Bierman. So one of the main things that we were focused at, since I worked in the pediatric department for children who had had spinal cord injury, is improving their trunk control. So pretty much their ability to sit up, reach for different things, and in that way improve their quality of life. So we did different techniques of therapy, for example, so putting a child into a harness and then putting their legs in a walking motion over a treadmill to simulate that walking was, for example, one of the therapies used. And then, as you can see here, that is the improvement over a certain amount of sessions that we did. And then through that walking, the idea behind it was that the spinal cord has a certain level of plasticity, meaning that it can regenerate. And yeah. So one of the main things that we did while I was there was we did a safety and feasibility study, looking to see that if we applied transcutaneous spinal cord stimulation, whether or not that would improve the trunk control of these patients. And so during the study, I was kind of in control of the CV parameters. So I was looking at heart rate, EKG, blood pressure, all of that important stuff, and just making sure whether or not it would be safe for the patient or subject to receive that stimulation. So this is kind of what it looked like throughout the experiment. So we had many different devices that were attached to the patient, such as the X-Sense, which would be converted to a computer and turn the patient kind of into a robot, which would later be used to look at the different angles of their body and the pressure. And then we also had EMG and muscle electrons that were placed all over the body, which would pretty much look at the different muscle activations and whether or not the stimulation was, doing anything. And then, of course, the stimulation, which was applied directly to the spinal cord. And they actually let me try out the stimulation, and it feels super weird. Makes you sit up super straight. But yeah, and then this is what it looked like throughout the experiment. There were a bunch of different people throughout the room monitoring whether the patient was comfortable, me with the CV parameters, different therapists, the people who were giving the stimulation, etc. And then, of course, the people who are taking the data. So although this was a safety and feasibility study, we did also kind of look at the efficacy of it. So we used a force plate, and then while the subject was receiving stimulation, we had them lean forward, backwards, left, right, do a bunch of different things to kind of see what their range of motion was. And so as you can tell, without the stimulation, the range of motion was a lot less than with the stimulation. So yeah. So up here, these were my two fellow interns and I. And then we also did a bunch of data analysis after these experiments, pretty much looking at the muscle activation, like before, if it had any effect on the subject and if it did improve their quality. And then the bottom left, this was where we did all of our experiments. We called it the Discovery Cove. It's a tiny, tiny room where we do all of our experiments, and most of the therapy for the pediatric department. Right next to it is the much bigger adult therapy section. And then outside of the internship, the first 2 weeks I was with one family with an 18-year-old and 16-year-old son who took me all around Louisville on these electric scooters, introduced me to Krispy Kreme donuts, which I'm thankful for. And then for the other 4 weeks, I was with another intern, Anza, who presented earlier today. She was with the adults. And we went to go get ice cream nearly every single day. So yeah. And then advice to future interns is ask as many questions. The more you ask, the more you learn. And yeah, thank you so much.